Hi, my name is Grace Barnes, and today I'll be going over horse health checks. My horse is Rudy, and my handler is Kelsey Bromling. We use horse health checks to assess the health and care of the horse in order to prevent and solve problems. The types of horse health checks that we use are digital pulse, gut sounds, skin pliability, capillary refill, mucous membranes, respiration rate, heart rate, pulse, temperature, and most importantly, general appearance and behavior. For the first check, we look at the general appearance of the horse, and it's important that you know what is normal and average for your horse so that you can see differences as you look at him day to day. Now, you should be able to tell what his attitude is like, energy level, eating and drinking habits, skin and coat condition, and his stall habits. That way, if something's out of the ordinary, you can tell it right away and proceed with further checks to monitor his health. Unless it's common for your horse, they should not be lethargic, pacing, sweating, anxious, off their feed, or any other behavior that is out of the ordinary. Now, when you're looking at these general appearances, you should always keep in mind the weather, the exercise level of the horse, the stress, and any dietary changes that might occur to change these. Along with the general appearance, you should also look at the horse's feces and urine, as they are often good indicators of your horse's health. With the urine, it should be clear whitish to a yellow, light brown. If it's red, this could indicate azoturia or tying up, which means that there's blood in the urine. Also, you should look at the horse's feces. It should be a tan yellow to a dark green and should have a light sheen on it. The consistency should be firm and round, and they should produce 28 to 50 pounds a day. If the feces is too hard or dry, it can indicate dehydration or lack of exercise, and if it's too loose, it could indicate digestive tract problems. Another key indicator of horse health is the mucous membranes, which can be taken at the gums, the conjunctiva of the eye, or the vulva on mares. It is used to determine the hydration of the horse and also general facts about the horse's health. The color can give us a lot of indicators. The usual is pink and moist, but a fiery brick red could indicate infection, bluish purple could indicate lack of oxygen, yellow could indicate jaundice, pale would be shock or anemia, and dry would be dehydration. Now I'm going to check this on Butters. Going to go up to him nicely, using Butters. If we look inside his upper lip, I see it's pink and moist, so Butters is normal. Another check that can be done at the mucous membrane sites is called capillary refill. Capillary refill measures how fast blood can go back to an area, and it checks hydration. If it doesn't come back within 1 to 2 seconds, then the horse may be dehydrated. To check this, I will take my thumb, press it up against his gums, wait for the skin to turn white, and then remove the pressure. The pink color should come back in 1 to 2 seconds. So now I'm going to go lift beside his lip. I see it's pink and moist and healthy. Press it down until it turns pale. Remove the thumb, and it returned back to normal in 1 to 2 seconds, so Butters is normal. The next check I will be discussing is the pulse. We take the pulse to measure the horse's pain level at a given time, but this can be influenced by stress, exercise, or pain. We take it at the external maxillary artery under the jaw, which is the most common. We do it by taking our fingers and gently pressing them up against the horse's vein and then timing for 10 or 15 seconds. You can also take the pulse behind the knee for the radial pulse, or under the fetlock and behind the pastern for a digital pulse. But you only want to find a digital pulse if there's a length to the foot. The normal range is 32 to 44 beats per minute, but as I said, it can be higher because of a horse's pain level, stress, or exercise. If it's lower, then this usually indicates shock. So now, I'm going to go take the horse's pulse, and I will have my handler time me for 15 seconds. And once I find the pulse, I'll tell you to go. I had 9. Since you timed me for 15 seconds, I will multiply by 4 and get 36 beats per minute, which is perfectly normal. The next check is to see if we have a digital pulse. A digital pulse indicates an issue in the hoof and a potential lameness. It is taken below the fetlock and behind the pastern here. Normal, you should not be able to feel the pulse in this area. If we do have a digital pulse, it will be bounding and rapid, and that's a really big problem, and it should be further looked into. So now I'm going to check his digital pulse. I'm going to be really safe. Keep your hands on the horse, monitor his behavior. And now I'm only going to squat. I'm not going to kneel or sit on the ground. So I'm going to bring my fingers down. And I don't see anything, but I'll just check again. And I couldn't feel anything, so Butters is normal. The next check is the heart rate. It measures the same thing as pulse, but is taken differently, and we use a stethoscope for it. It is taken on the heart girth behind the elbow. Again, this can indicate pain level, stress, or recent exercise, and it can help us diagnose problems in the horse. The normal is 32 to 44 beats per minute, which is the same as the pulse. Higher can indicate pain, lower can indicate shock. So now I will go, and I will take the heart rate, and I will have my handler time me for 15 seconds. There you go. And I got 9. Now since we did it for 15 seconds, I multiplied 9 times 4, and we have 36, which is normal.